Kwashiorkor and Marasmus are both forms of severe malnutrition. These reviews differs in their comparison, so I and my colleagues did some researches in their analysis. Please stay tuned. I'm Solution.
I am Nurse Deborah.
I'm not Chama.
I'm not David.
Now, let's define the two forms of severe malnutrition. Kwashiorkor is a severe form of malnutrition mainly caused by not enough protein in diet. Its name is derived from the Ga language in Ghana, roughly meaning the sickness a baby gets when the new baby is born, because it usually shows up after weaning. Now, marasmus comes from a Greek word called marasmus, which is derived from the Greek verb marane, meaning wasting. It is a severe form of malnutrition due to total lack of protein and calories. Now, these two forms of malnutrition has their signs and symptoms.
Alright, the signs and symptoms of Kwashiorkor is edema.
Edema simply means the swelling of feet, ankle, and belly.
Secondly, skin changes.
It's a patch on the skin attacking everywhere on the skin.
Thirdly, hair changes.
The hair becomes thin.
Then fourthly, enlarged of liver.
The belly of the person, the child, becomes bigger.
Alright, let's go to marasmus. One, we have several wasting.
Several ways it means extreme loss.
Secondly, old man face.
The person's face becomes thin.
Then the thirdly, several underweights.
The person's weight becomes less than 60.
And fourth, the last but not the least, thin and loose skin.
The person becomes more thinner.
Alright.
The question that will be in our mind is, can an adult suffer from these two forms of severe malnutrition? The answer is a very big no.
Alright, let's go to age difference of Kwashiorkor. In age difference, Kwashiorkor usually affects the children from 1 to 4 years old, peak age 18 to 24 months.
It usually occurs after weaning, when the new baby is born and the other baby is the breast, like the mother stops giving the other baby breast and moves the baby to a starchy food with low protein.
Okay, in marasmus, usually affect infants from 6 to 18 months old.
This usually occurs in their first year of life, mostly when breastfeeding stops early and the food given to that baby lacks calories. Now, let's go to the prevention and cure of these two forms. Now remember, if I'm talking about cure, it does not mean that you swallow medication. It has its own different type of cure.
Prevention of marasmus. The mother needs to take more of carbohydrates, proteins, and fibers, vitamins to enlighten her body. How to treat the baby from marasmus? Give more of breastfeeding, baby formulas. What do I mean by baby formulas? Buy milks for the baby. Enlighten the baby from the first 1 to 6 months. Do baby friendly, like continuous breastfeeding for the baby. Then you continue with baby formulas, like milk, any milk of your choice, any milk that enhances you. Don't go and buy Mixi or Dano. It's not for the baby. All these things needs to follow and affect the baby. Don't say that Nigeria is doing you that. Try for your child. Prevention is more affordable than cure. Thank you. Okay, for Kwashiorkor,
Yes.
For Kwashiorkor, you take the child should take eggs. You know what I mean by protein, and to enlighten the body. Egg, beans, all those things that will nourish the body. Then how to treat it? Take more of dehydrated water. Dehydrate the child. Clean water, don't mean hydrate the child. Clean water. Baby should take clean water. Enough food. Enough proteinous foods like eggs, beans, foods that has protein, and you're not an illiterate, you know them. You give your child to enlighten their safely living.
In conclusion, just remember that Kwashiorkor and Marasmus are both forms of severe protein energy malnutrition. Yes, but they differ in their causes and presentation. Now, Kwashiorkor is mainly caused by total lack of what protein, even when calories intake is what adequate. Then now in marasmus, marasmus is as a result of total lack of all nutrients, protein, carbs, and fats. Now let's just think of total starvation. You see the child appears so emaciated and severe muscle wasting and very thin, little body fat, while the peak and hallmark of kwashiorkor is edema, swelling of the face, belly, and feet. Now, note that both are preventable by adequate nutrition. Both reflect on food insecurity and poor dietary quality. Both require careful, gradual, and nutritional rehabilitation to avoid refeeding syndrome. Quick to remember, kwashiorkor, edema, swelling, and it is a protein deficiency. Marasmus is withering away, like, so when somebody is looking wasting, if I say withering, somebody is looking wrinkled, shriveled, and it is a calorie and protein deficiency. See you next time. Don't forget to like and share. You can ask your question and make your suggestion at the comment section. Bye. See you next time.